You are listening to the Journal of Rheumatology's Editor's Picks with Dr. Earl Silverman, Editor-in-Chief.
Hello again, this is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology, welcoming you to the February 2025 edition of Editor's Summary. This month, my interview is with Ms. Nathalie Carrier and Dr. Girbois discussing their article titled Changes at Presentation in Patients with Early Rheumatoid Arthritis, a 24-year study of the early undifferentiated polyarthritis EUPA cohort. And what do you think of the implications of this for moving forward for patient care?
Yeah, well, for clinicians, I think it's important to recognize that what we call the prototypic RAs, that is the very inflammatory, seropositive, erosive disease, is and likely will become rarer. And the patients will more and more be seronegative and have lower levels of inflammation, at least in the blood. So it is important to be more reliant for diagnosis on clinical evidence of synovitis and less on paraclinical signs such as increased CRP or erosions or antibodies. And I think maybe the second point for the clinician is that the patients that we will recruit over the next years will likely suffer from more and more comorbidities. This is important to recognize because comorbidities may complicate choices of treatment, and comorbidities themselves need adequate treatment. So I think it's two messages, I think, for the clinicians.
I hope you enjoyed listening to part of my interview with the first and senior authors of a paper titled Changes at Presentation in Patients with Early Rheumatoid Arthritis, a 24-year study of the early undifferentiated polyarthritis EUPA cohort. For an in-depth overview of the article, please listen to the full interview and read both the full-length article and an accompanying editorial titled Rheumatoid Arthritis Has Changed Dramatically Over the Past 3 Decades, but Has Rheumatoid Arthritis Itself Changed? By Drs. Carol Hitchen and Hani Agabawawi, which are available on our website at www.jrheum.org. The next article to bring your attention to is Disability Related to the Upper Extremities in Early Rheumatoid Arthritis, Long-Term Course and Disease Variable Impact, a cohort study, and is by Ridholm and co-authors. In this study, they examined the course of disability related to upper extremities in an inception cohort of 222 patients with early RA after a follow-up of 10 years. They assessed the upper limb disability using a subscore of the HAQ-DI and measured the average grip force of the dominant hand. They found that the upper limb HAQ-DI decreased significantly after 6 months of follow-up, remained stable for the next 2 years, but then again decreased. They found a good correlation of the upper limb extremity HAQ-DI with grip strength, patient's global assessment, and patient's assessment of pain at all time points through 5 years. But they only found a moderate to weak correlation with the swollen joint count and tender joint count and measures of inflammation, such as CRP and ESR. The mean average grip force of the dominant hand increased from 40% of the expected at inclusion to 66% of expected at 10 years. The authors authors concluded that the correlations with clinical parameters underline that there is a major impact of pain on impaired hand function in early RA. They also saw that patients with early RA and poor patient-measured outcomes early were at an increased risk of persistent limitation in activities of daily living that require use of the upper limb. It is not clear that patients who enter randomized controlled trials reflect the populations of patients seen in clinical practice. Ella and co-authors examined this issue in patients with psoriatic arthritis in paper title, Patient Profiles in Randomized Controlled Trials versus a Real-World Study in Psoriatic Arthritis, a Scoping Review and Meta-Analysis. The authors compared 5,654 patients from their scoping literature review and meta-analysis to 10 phase 3 RTCs of biologic DMARDs in 930 patients from an international observational study of biologics in PSA patients, or the PSA Bio. Patients in RTCs had higher swollen and joint counts, more frequently had enthesitis and dactylitis, had more active skin disease than patients in the international observational cohort. PGA and disease impact, as assessed by patient-measured outcomes, were high and comparable in both data sets. Overall, 44% of the observational cohort would not have fulfilled the swollen joint count or tender joint count requirement of greater than or equal to 3 for each, which is the case in most RTCs. As patients with PSA entered in trials biologics are not the same as those in clinical practice, therefore, caution should be taken when extrapolating data from clinical trials directly into clinical practice. Little is known about the perceptions of aging among individuals living with systemic lupus erythematosus. In a qualitative study titled The Living Experience of Older Adults with Systemic Lupus Erythematosus, Patients' Perspectives, Leiber and co-authors performed semi-structured interviews with 30 adults greater than or equal to 65 years of age with a mean SLE duration of 26.3 years. They found 4 overreaching themes emerged that describe the essence of aging in patients with SLE. One was SLE and its comorbidities. 2, the cumulative impact of SLE symptoms. 3, the disease trajectory itself. And 4, their self-perceptions of aging. The participants' lived experience of the cumulative impact of SLE symptoms and SLE disease trajectory underscored the diversity of their experiences. Self-perceptions of aging differed among participants, but there was an interplay of SLE symptoms and related comorbidity with the aging experience in most of the participants. In rheumatic diseases such as RA and OA, obesity has been shown to influence disease activity and outcome. In their paper titled Symptom, Severity, and Glucocorticoid Dosing in Patients with Polymyalgia, Rheumatica, and Obesity, Seminio and co-authors examined the effects of obesity on outcome and treatment in 83 patients with recent onset polymyalgia rheumatica. They found that obesity affected symptom severity. Patients had a higher MHAC. There was more fatigue with a lower physical component, summary of the SF-36 and the social function index on the SF-36. Obesity also affected prednisone dosing, although the mean initial prednisone dose were similar among the weight groups. At 6 months, obese patients were being treated with a higher mean daily prednisone dose. Clinical features, laboratory and ultrasound results were similar. The reason that obesity affected both symptom severity and prednisone dosing is not clear, however, and the authors hypothesize that there may be differences in subjective pain perception rather than increased inflammation, as clinical features, laboratory, and ultrasound findings were similar. For patients with systemic sclerosis, the two most important features that affect quality of life are fatigue and Raynaud's phenomena. It is not known whether interventions that improve parasympathetic tone result in an improvement of symptoms, which include fatigue. The Apollo wearable emits tune vibratory stimulation. In unrelated studies, it has been shown that vibration itself can improve stress. Therefore, Hannamaker and colleagues performed a study of the Apollo wearable in their paper titled Associations of the Apollo Wearable with Fatigue, Raynaud Phenomena, and Quality of Life in Patients with Systemic Sclerosis, a pilot study. They found that in 25 adult participants, after 4 weeks of using the Apollo wearable, they reported less fatigue with a decrease in Raynaud's phenomena, with an improvement in physical function, sleep disturbance, and depression. This study suggests there is a potential of the Apollo wearable to improve autonomic nervous function. Of course, a much larger placebo-controlled trial is required to confirm these interesting results of this pilot study. Although pelvic MRI is frequently performed in patients suspected of having axial juvenile spondyloarthritis, it is not clear how important this assessment is in patients who are suspected of having axial disease. Mayer and co-authors address this issue in their paper titled Effect of Characteristic Inflammatory and Structural Pelvic Magnetic Imaging Lesions on Expert Assessment of Axial Juvenile Spondyloarthritis. This was a cross-sectional study of 303 patients with juvenile spondyloarthritis with suspected axial disease. The expert panel achieved agreement on 89.8% of the patients based on the clinical features alone. When MRI was added, it affected the agreement in 38.9% of the patients. Interesting, expert agreement with high confidence was achieved in only 43.2% of the patients, with clinical data alone, but increased to 70.6% when clinical data was added to imaging data. The best model for agreement included HLA-B27 status, pain that improved with activity, and bone marrow edema on MRI. The study highlights that axial disease can be difficult to diagnose in patients with a juvenile spondyloarthritis, and that MRI is an important study in the determination of axial disease. The next paper is again a pediatric paper and examines the important issue of TMJ arthritis in patients with JIA. It is by Strostrup and co-authors and is titled Effects of Biologics on Temporomandibular Joint Inflammation in Juvenile Idiopathic Arthritis. This was a prospective single-center study of 18 consecutive patients with JRA with MRI-verified TMJ arthritis who were treated with a tumor necrosis factor inhibitor. These authors in this well-constructed and well-performed study found that there was significant improvement in TMJ movement, pain, morning stiffness, opening capacity, and maximal incisor opening, with a significant decrease in the MRI inflammation score. This study confirms the widely held but not systematically proven belief that anti-TNF agents are important to maintain the function and at times can improve TMJ function in JAA patients. The study was too short to show the long-term maintenance of jaw function and lack of jaw deformity associated with prolonged anti-TNF agent use and the shown TMJ improvement. Evidence for an association of smoking with gout is conflicting. In their paper, Association of Past Smoking Status with Gout in Maori Patients in Erythematosus, New Zealand, Fanning and co-authors examined if there was association with either present or past smoking in a gout cohort of 3 different ethnic populations in New Zealand. They found that current smoking was not associated with gout in either of the 3 Maori, Pacific, or European cohorts. However, being an ex-smoker was associated with a higher prevalence of gout in the Maori, but not the Pacific peoples or the European cohorts. There was no association of smoker status with serum urate concentrations in participants without gout. It is not clear why there is an association of ex-smoking status with gout. The use of large language models is ever increasing in medicine. In Panorama 360 Degrees, a rheumatology article this month, Omar and co-authors evaluated how large language models, specifically ChatGPT-40, include Sonnet 3.5, performed in diagnosis of 64 cases from the New England Journal of Medicine Image Challenge. This article makes interesting reading for all of us as the role of large language models continues to be defined in medicine. This month, there are 2 images in rheumatology. The first is titled Vanishing Abdominal Aorta and describes a 6-year-old woman who presented with pyelonephritis and sepsis. A contrast-enhanced CT showed the absence of the abdominal aorta from below the branch of the renal artery to the bilateral common arteries. There were multiple collaterals present. The woman denied any symptoms of ischemia. The second image is titled An Atypical presentation of parvo B19 arthritis and describes a 50-year-old man who presented with fevers, cervical spine pain, and stiffness following interaction with a child with confirmed parvovirus B19 infection. The parvovirus infection was confirmed serologically. MRI of the neck demonstrated intraspinous bursitis from C2 to C5, which resolved on its own. I want to thank you for listening to this podcast and encourage you to read the articles in the February 2025 edition of the Journal of Rheumatology, either in the print edition or the online edition, which is available at www.jrheum.org. Please watch my interview with authors of the highlighted articles, not only of this month, but if you missed them, previous months. They are available for viewing at our website and on YouTube. If you have any comments or questions on these highlighted articles or any article in the Journal of Rheumatology, please send them to manuscripts@jrheum.org. And please join me for the March 2025 edition of Editor's Summary. Thank you for listening and see you next month.